Federal government remains shut down, and there is growing anxiety for Americans who are concerned about health care costs. At the top of that pyramid are folks that utilize Affordable Care Act, ACA tax credits that bring those costs down. That group includes people that don't get health insurance through work, people who only work part-time, early retirees that can't use Medicaid yet, and others. And the Obama-era program was supplemented in 2021 in the American Rescue Plan, and expanding coverage to more income groups and increasing the amount of credits and how much they were worth. And the big beautiful bill was heavily criticized by some for not renewing those ACA tax credits. Republicans in Congress have said that they were too costly and that other medical care programs exist for the people that need it most. The debate is at the center of the government shutdown, and Democrats want to make a deal to fund the government, but one that includes provisions to extend the ACA tax credits. Today, we heard from some Idahoans about what could happen to their bills if a deal isn't made, and soon. As the federal government shutdown continues, questions remain about a deal to continue ACA tax credits.
And if Republicans continue this refusal to act, it will mean people across America skip their basic health care. They will skimp on their prescriptions. They will miss out on life-saving treatments.
U.S. Senator Patty Murray, a Democrat from Washington state, has eyes on the state of Idaho as she pursues a deal in Congress. The state, Idaho, has the earliest window for open enrollment on a state health exchange.
Open enrollment in Idaho starts next week. Republican leaders are so determined to dodge this issue, they would rather shut down the government than work on solutions.
I am overwhelmed with calls from people all over the state who are frustrated and afraid about the things that are happening in their health care.
Idaho Senate Minority Leader Melissa Wintrow joined the call to Congress to take action, extending ACA tax credits set to expire at the end of the year.
If those credits expire, a 55-year-old earning about $63,000 a year in Idaho will see their annual premiums increase nearly $4,000. No one can afford that.
If Enhanced Affordable Care Act, ACA premium tax credits do expire in 2026, millions of people are expected to lose subsidized health coverage, leading to significant premium increases for many, and an estimated 4 million people will become uninsured. As of 2024, about 100,000 Idahoans receive an ACA credit to lower the cost of their health insurance purchased through the state marketplace, Your Health Idaho. Insurers are expected to raise premiums to compensate for ACA changes. Forecasters believe that healthcare providers may face billions in lost revenue, leading to a substantial increase in uncompensated care costs, which is ultimately going to increase healthcare costs for just about everyone.
My name is Bob McMichael. I am a retired school teacher and professor, and I live in a rural town called Council.
Idahoans like Bob already see a scary financial future. He and his wife currently utilize ACA credits.
We are finally, though, one of those couples who are senior citizens on a fixed income. I never, ever thought I would say that, but that's a fact for us now.
He got the letter recently that people are dreading, a notice of healthcare plan premium increases.
If the tax credits do get taken away, the annual cost of the plan that we are on will be almost $27,000. So even if they keep the tax credits and they somehow get put back in, our increase in our premium is going to be almost 800%, even if they reinstate the tax credits or if they are still on the table for us in 2026. It's going to be hard, but if they don't reinstate them, then we simply won't be able to afford any health care at all.
I have talked to a number of Republicans who just think this is not real, who haven't heard from people, who don't understand the reality of it in their own communities. So, boy, today, tomorrow, tell them your story. They need to understand this is real.
I experienced that in the Idaho legislature, is that there are many things that people don't believe, even though the data or the facts are there. So they have to hear the personal stories, and they have to hear from the people who voted for them.
That's our story. It's not unique, sadly, and it's pretty scary. I never ever thought I would see anything like what's going on right now.
So the debate in Congress stands like this. Republicans have said they want a clean funding bill to keep over the government and to reopen the government, I should say, before they would want to engage with Democrats on some type of a deal on tax credits or health care in general. Democrats, meanwhile, say that they don't trust the "we'll do it later." So Democrats are saying we will only really want to open the government with the deal that includes a provision in there for something like extending the ACA tax credits. It seems to be at a standstill. The word out of D.C. is negotiations are ongoing, but not moving quickly.